The Pandemic Fund project implemented by the Caribbean Public Health Agency, CARPHA, has as its central hub a dedicated web page containing reports, publications, workshop summaries, event updates and media content, all designed to keep stakeholders and the public informed.
We in countries have lessened in terms of saying focus just on COVID-19 surveillance. And that was expected because it's no longer something new. However, we encourage persons while they are not able or not doing COVID-19 surveillance, we encourage persons to look at hospitalization, to look at deaths, severe cases, because we still want to be able to look at the burden. And we think it's a burden. There are new variants that are going on.
Executive Director of CARPHA, Dr. Lisa Indar, says while COVID-19 is no longer classified as a global emergency, monitoring remains important. And she stresses that protecting health also comes down to personal responsibility.
When we know there's a variant, look out for our CARPHA watching briefs. We would put that out to say something new is coming out, or we have a new variant, or a new situation, or a rise in measles, or anything like that. And we say, protect, to encourage surveillance, and, to be vigilant, to encourage travelers' surveillance, because we have a lot of travelers coming.
CARPHA is also encouraging the continued practice of the 3 Ws. Wash your hands, wear a mask if you're sick, and watch your distance.
During COVID, we had hand washing and masking and all that, so that prevented other infectious diseases. But what we are seeing now is almost like a resurgence of gastrointestinal diseases and other types of diseases. So what CARPHA is recommended, we are saying to you, well, to be careful, to still follow safety practices. Wash your hands, wear a mask if you're sick, don't go in crowds if you are a risky person, if you're too old or if you have some underlying illness.
Dr. Indar emphasizes vaccines remain a cornerstone of public health, not only for COVID-19, but also for other vaccine-preventable diseases.
And if you have to take vaccines, take your necessary vaccines. The situation with the resurgence of measles and those outbreaks that we're seeing in the U.S. is because, persons are not vaccinated. But that causes a risk because we have seen a couple of cases coming in now into the region from persons who are not vaccinated, and then they may transfer it to someone who has not been fully immunized.
CARPHA is also closely monitoring emerging threats, including vector-borne diseases. Recently, PAHO issued a bulletin warning of a fever spreading throughout the Americas.
We are doing surveillance, and we would have put out also a bulletin about that, and we are encouraging persons, we can test, and we are able to prevent, we are able to test, and we are able to go through like enhancing surveillance to pick it up. So it's not for us to be alarmed, it's us to say, okay, enhancing surveillance for Zika or chikungunya, dengue or pooch and all of that, because you're doing, all-inclusive type surveillance.
CARPHA continues to strengthen the Caribbean's capacity to respond rapidly and effectively to public health emergencies, bringing together emergency response focal points, public health officers, laboratory professionals and specialists in risk communication. I'm Karen Kozia Phillip with your TTT News Health Check.